Tableau because you're going to be constantly building interactive dashboards that sort of display data for stakeholders to support their decision making. Things like using Jira. So if you're thinking of project management, so these are some tools that they use for project management. MS Teams, I think that cuts across. Is usually for virtual meetings and all of that. Visio is an application I think usually used by business analysts for process mapping. So if you're going to be in that space, this is some of the tools or one of the tools you have to sort of get conversant with. Then those who are in the digital marketing space, comms and engagement, you probably want to have a look at Hootsuite. Then you have SQL, Python. So these are typically tools for data analysts, data scientists, for them to do their regular day-to-day jobs. So, like I said, these are usually industry specific. So, depending on where you find yourself, then you know whatever skill you need to pick up in order to do your job. Oh. So let's look at the career opportunities in digital health. So I've tried to put them into five broad categories, even though it's when we now break it down, is much, much, much larger than this. So first of all, we look at clinical roles. So clinical roles tend to, bridge the gap between the healthcare teams and the technology solutions guys. So you talk about things like the clinical informatics people, you talk about the trainers, you talk about digital health consultants. So mostly is the people who have a very clinical background that tend to sort of pick up these roles. So you talk about things like also the chief clinical information officer or clinical information officer. So they bring their wealth of experience from that clinical background and find how to support the people building to sort of, solve that problem. Then look at the technical roles. Technical roles are those guys who are essentially responsible for developing and managing those health tech platforms. So, for example, you've got a telemedicine system. It's not built by a doctor, it's actually a technical person who has built that platform. You collect data on that platform. Who's going to analyze it? That's where the data analysts, sort of come in, the software engineers. It has to be secure because you're looking at things around data privacy, data protection, and all of that. That is where the cybersecurity specialist guys, the network guys come in. So that's like a brief overview of the technical role. So it's another role for people to consider if you're looking at something to do. And I know a lot of doctors who are quietly moved from clinical practice and now fully into software engineering or data analysis. Then you look at management and leadership roles. So under here, these guys typically oversee the implementation of new systems and lead change management. So, for example, a hospital decides that they're going to buy a new EMR system, electronic medical record system. You don't just buy the system and install it and say people should start using it. So there's typically a process for that. So that's where these guys come into people like project managers, people like business analysts, people like transformation leads really come into the picture. And you talk about change management. Change management is a very key component of whatever new solution you're trying to implement because if you don't manage that change, for people who are moving from, let's say, paper to digital, that's a big change. So it has to be managed properly. So these guys technically just oversee that whole process. Then the fourth group are the research and innovation roles. So these are the guys who are typically innovating around medical devices, around AI tools, around patient engagement platforms. Now we are seeing a lot of investment and drive into AI these days. Who are the guys doing this? Is the AI, and machine learning specialists who are sort of looking into all of those tools, and a lot of them are programmers actually. So they are always looking for what new tools can we build, how can we make this process better? What new solution can we, do both for the patients and both for the providers, really. So you also have the UI UX experts or UI UX designer. So these are examples of roles too for you to consider. Then the fifth and the final group is the education and policy roles. So this one is typically focused on we want to upskill healthcare professionals, we want to improve healthcare or health tech regulations. Now, across board, digital literacy around healthcare professionals is not really where it ought to be now. That's where you see during some implementations, a lot of people are struggling with new systems and all of that, because digital literacy is not there. So if you're someone who is interested in getting into that space, then there's a lot of work that needs to be, done. Then we talk about regulations. So a good example is this whole issue of AI now. There are conversations around ethics, around whole AI. So, what kind of regulations do we need to keep in place? How do we make sure this AI is safe? How do we ensure that whoever that is building whatever they are building, they are going to stick to rules? We're not going to harm patients and all of that. So that's where the policy people come in. They make those rules and regulations to make sure people are on the right track in terms of what they're doing. So these are like the five major groups of career opportunities that exist in digital health space. I think I'm going to be looking at about five of them in a little bit more detail to give you an idea of what's required. So the first one on the list is the product guys or the product manager. So I guess a lot of us will be very familiar with be hearing product management or product manager and all of that. So basically, the product guys they oversee the development of very new technologies and solution, and their work is to ensure that whatever we are doing ensures it's aligned with both the healthcare needs and the technical capabilities that is required. So they look at the design, development, and implementation of any new product. So for any digital to digital product or whatever, there's usually a product manager behind the scenes who looks after that product. So what are the some of the relevant certifications you probably need? So excuse me. There's a certified Scrum Master, which helps you understand how to manage this product's life cycle. So product development is usually very fast paced. You're testing, you're changing, you're iterating, you're updating, getting feedback. So it's pretty fast paced. So you need to be able to sort of get into that flow. Then there's the PMP or project management or Prince 2, which gives you a broad sense of how to manage projects really. Then there's the CHISP, which sort of gives you an idea around managing health tech products. So again, this list is not exhaustive because there are a lot of relevant product manager certifications that can be done out there. And in terms of transferable skills from the clinical standpoint or from healthcare professional. So as healthcare people, clinical problem solving, so we tend to understand the real, challenges in using a solution or a product in the hospital. So we can support those product guys to do this. We have communication skills, which is very necessary because you're going to be interfacing a lot with the technical teams and the clinical teams. There are also the leadership skills, especially those who are sort of maybe consultants or senior healthcare people. So that becomes very handy here because you're going to be leading a lot of teams to be able to just deliver a product rather. Then project management skills. You need to be able to manage timelines and the resources allocated for that particular product. So the required skills still ties into the certifications. You need to understand product management fundamentals. You need to be very familiar with agile or scrum methods. You need to have very strong communication and organizational skills and have very basic knowledge of healthcare systems and digital technologies. So on this side now, you see I put something around career growth. So this is a question I get a lot. So okay, as a product manager, what happened? Is this where I'm going to be stuck? Is there any career progression for me? So you could have become a senior product manager, you could become the lead product manager, you could become a director of product management, you could become a chief product officer, you could become a health tech consultant, or you could even become chief, excuse me, you could become a chief executive officer wherever it is you're working. So this gives you an idea of the career trajectory of people who sort of tend to work in product management. So, and as you move down from number one to number six, the responsibilities increase, and of course, your pay also increases. So, product manager is something worth considering. And the next one is the project manager. So there's usually a lot of confusion around product and project manager. So now the project manager oversees the implementation of digital health tools and solutions, right? Such as EHRs or whatever tools you want to implement. You always need a project manager to.
Yes, sir.
Sorry, is that a question? No, okay. So, whatever it is you think you want to implement or deploy, you always need a project manager to manage that process. So, we as project managers sort of ensure smooth integration within existing healthcare, workflows. So, for example, now, let's say we're going to do an EMR upgrade in a hospital. So that means we're probably using an older version of an EMR, and you're bringing in a new one. So the project manager's work is to ensure we seamlessly bring in the new one without halting or stopping clinical processes or whatever, and sort of transition people smoothly onto the new one. So it's complex, it's complicated, but I mean, that's their job. In terms of relevant certification, so again, Prince 2 PMP comes in very handy. So it sort of gives you an idea on how to manage project and resources effectively. Then there's the CHTS, which sort of gives you an idea on tech needs of healthcare environments and ITO. Again, this list is not exhaustive because there are a lot of courses and certifications for product project managers out there. In terms of transferable skills, brought out leadership, stakeholder management. This is very, very key because you need to carry everybody along in that project. So, because you're interfacing with the clinicians, the nurses, the administrators, secretaries, IT, every single body has to be carried along. So your stakeholder management skills has to be really top notch, really. And again, I think it's something we bring to the table because as a healthcare person, we're basically interacting with all the stakeholders who are involved in patient care. I'm talking to the nurses, I'm talking to the consultants, I'm talking to the pharmacists, I'm talking to the patient relatives, I'm talking to the patient, him or herself. So you're it's easy to bring that across, to the other side. I brought up problem solving skills. I talked about clinical workflow understanding. So I think any project manager who has a very sound understanding of how healthcare works is actually at an advantage that one that who doesn't know really. So then some of the required skills, again, it's not exhaustive. So basic project management skills. Then you need to be very familiar with project management tools like Asana, like MS Projects, like Jira. You could look this up really later if you don't know them. Organizational communication skills, then ability to work in a multidisciplinary environment because you're going to be interacting with a lot of people. Then, in terms of career growth, here I've brought out like 8 roles where a project manager can actually move into. So, typically, most people usually start as an assistant project manager, then they become the project manager, then they become the senior project manager, Then some of them move into becoming program manager. So the difference between a program and a project is just one single, like call it activity, but it becomes a program when you have more than one or more projects running at the same time. So you could have like five projects running at the same time. So it's the program manager who sort of manages those five projects. You could become a program director, you could become an IT director, you could become a chief information officer, you could become a chief digital officer. And again, like the product one, as you move down, this list, responsibilities increase again, and your pay also sort of increases. So this gives you an idea of what's possible. So you could just spend some time to research some of these roles and see what they get to offer. Right. I don't know if there's any questions, so I'll probably move to the next one. So this is information governance. So this is another interesting role in digital health, really. So basically, all the policies, all the procedures, everything around compliance relating to healthcare information and e-security lies within, the remit of the information governance, or IG, as we popularly call them. So they make sure that the data of the patient is handled in accordance with regulations. So in like the UK, you have the GDPR, the DPA. In the US, you have the HIPAA and all of that. So the IG guys make sure we are sticking to these policies and regulation as we handle healthcare data. So they also oversee the governance of clinical and administrative, information systems. So what certifications do you need to get into this space? You have the information governance professionals that are certified. So it gives you a very deep insight into the expertise of what you need to, sort of do around IG, or information governance. Then there's the GDPR Foundation and Practitioner Certification. Then for those in the UK, there's this NHS IG toolkit on, I think, NHS Digital or NHS England. I'm not sure at the moment, but it's there. If you search for this, you'll find it. So this gives you like fundamental training on, IG, especially as it applies in the NHS. Then there are lots of health information management certifications there. So gives you an idea around health data systems and what compliance needs that they require. So in terms of transferable skills, I brought out compliance knowledge, I brought out leadership, I brought out data management, I brought out communication. Then the ones we require understanding of data protection principles and regulations. So, I mean, by virtue of our training as healthcare professionals, I think we are sort of introduced into some of the elements of, patient confidentiality, why I shouldn't be sharing patient data and all of that. So, this gives you an idea. So, but with further training, you sort of, improve on that information or knowledge. Then attention to detail and ability to handle sensitive information. Then very proficient in different frameworks, risk management and compliance reporting. So in terms of career growth, again, what can we go really? So there's the IG officer. So most people typically start out from the information governance officer level. Then you move to become an IG manager, then IG lead. There's the head of information governance. You could become a data protection officer. You could become chief privacy officer, chief data officer. You could go into compliance. You could become an information security manager, data privacy consultant, or just say, okay, I want to go into risk management really, because it also sort of applies into information governance. So again, these are 11 different, growth trajectories possible for those in the IG space, and each one of them comes with its own, requirements, complexity, and I think as you move up again, more, what do you call it now? Responsibility and more pay and all of that. So that's information governance. So again, There is no digital health tool or application, either development or implementation, that doesn't have an IG lead. So there's always, even though there are a lot of them are actually behind the scenes, but they are there. They must be there. So you can't do without one. So that's information governance. Then quickly, let's look at change management. So initially, I talked about change. We're moving from paper to digital. That's a big change. So let's say you've been running a hospital for the past 15 years, 20 years, all your staff, they've been using paper, they've gotten used to paper. And one day you say, we're bringing in electronic medical records. You don't just drop that on them. It's a change, and that has to be managed carefully. So that's where the change management guys come into the picture. So basically, they lead the planning, execution, and evaluation of organizational change initiatives, particularly around integration of new technologies in healthcare settings. So they are looking at things, okay, what's the impact of this change really? So are people going to lose their jobs? Do we need to reassure staff that their roles are secure? A whole lot around this really. So they will usually guide the project team through this whole process of how do we get users to use this, ensuring the smooth transition and minimal disruption. So again, every large scale implementation usually requires a change management person on that team, or else your project might really fail, really, or you have poor adoption because you didn't engage properly. So some of the relevant certifications, again, this is not exhaustive. You have the change management certification, which gives you foundation about the methodologies about managing successful change. PMP, again, Prince 2 is good. So I think by default, every healthcare professional should just do Prince 2 or have a basic understanding of how projects run, because everything is basically a project in healthcare or digital health. Then there's the Change Management Foundation certification, that's the APMG. Then you can also do the CHPS. In terms of the skills, leadership, communication, problem solving, stakeholder engagement, very key. And these are some of the required skills that you need, especially for entry level roles. Then on this other side, again, we'll look at some of the different career options available: change analyst, coordinator, specialist, lead manager, director of change management, chief transformation officer, process improvement manager. So these are different options, that 9 to 5 roles for people who are looking at change as an occupation. Then I think this is the last one on my list. Again, it's not exhaustive, as the business analyst. So, business analysts, what do they do? Again, these guys are mostly behind the scenes. So, they bridge the gap between the business needs and the technology solutions. So, typically, their work is to understand what are the processes in the organization, what's the current state, and try to figure out what the future state is going to need, and supports the solution, whatever. So, like I said, they analyze the process, they define the requirements, and they collaborate with stakeholders to design and implement the solution. So, every project requires a business analyst if you're going to run it effectively, really, for it to make sense. So, on that project team, you typically have a business analyst. So, they are the ones that go into the hospital or wherever you want to implement. They're asking all the hard questions. They're trying to understand, how do doctors work here? How do secretaries work here? And a whole lot of stuff, really. So they get all of that information, they document them, and support the tech teams in terms of building whatever solution they have. So some of the certifications, there's the ECBA from the International Institute of Business Analysts. There's the CBAP, so that's for Advanced Business Analyst. Then you could do the Scrum Master, then the Lean Six Sigma, because again, as a business analyst, you're looking for, as you're studying people or processes, you're trying to figure out areas for improvement, really, to enhance efficiency, really. So Lean Six Sigma actually comes in handy. Then some of transferable skills here is analytical thinking, communication, problem solving, and process mapping. So this process mapping is a very important skill that every business analyst actually needs to, have, design the current workflow and tell us where the improvements are. And these are some of the required skills that we need. In terms of career growth, a lot of people start off as junior, business analyst or a BA intern. You can move on to become the senior business analyst, lead business analyst, BA manager, head of business analyst, and chief business analyst. So these are also potential roles for people to look at in terms of, okay, I'm not going to be stuck here. I actually have a clear plan of where I am going to as a business analyst. So let's look at some of the benefits of, again, that list is not exhaustive. I think I have a guide somewhere I could share about different roles. So these are some of the benefits of working in digital health because a lot of people, I mean, I get this question a lot, what are the benefits? Do you miss clinical medicine and all of that? So number one is growth and innovation. So you're constantly working with people who are looking to, design new solutions to help people, you're making a difference. You're working with a lot of people, it's interdisciplinary. You're not working alone. It's similar to what we do in the hospital, basically. You're interfacing with the clinical teams, IT teams, admin teams, CEOs, and all of that, really. So it's interesting, is in high demand, really. So again, looking at what's happening in terms of the investments going into, digital health, AI, and all of that. So you're constantly going to, keep needing, these professionals. Offers a good salary, gives you a lot of flexibility. There's opportunities for career advancement. I mean, I've shown a lot of the options that are available for people to move on to. You're involved with cutting edge, technology every day. You're ultimately improving healthcare, and you get to collaborate a lot with different people, and it's really exciting and challenging work. So looking at what I do every day is not actually the same. So it's one day one day one challenge, really. Then some quick tips for you to sort of excel. Number one is continuous learning. You enroll. So I get a lot of this. Should I go and do a master's, or should I just do a certification, or how do I really do this? So most times I'll probably say just take all those short courses on Udemy, Coursera to understand, the basics and all of that. Then, because going for a postgrad degree comes at a cost, which you need to sort of weigh. Is it really, can I afford this, or what's my growth trajectory? So you need to carefully evaluate that. Then attend a lot of industry webinars and, conferences. I mean, a lot of people online, a lot of webinars, virtual, the free ones, really. Attend them as much as possible to understand what's going on in the industry, and that can sort of help you decide, okay, this is where I want to go, or this is the direction I want to go. Then you have to network a lot. LinkedIn is a very good place for people to network. There are a lot of digital health groups on LinkedIn. You look for them, join them, and see what's happening there. There are professional organizations like the HIMSS. These are like the sort of global leaders in digital health tech, and all of that. So you could join them. I know a lot of them offer discounts for student memberships and all of that. So it's something worth exploring. Then hands-on experience. So this one is really, really, really very important because that's the way you can build the skills. Because for people who are looking for jobs, we are concerned, or we're asking, what's your experience? What have you done? That's the question most people ask you. What have you done? So it's not just the theory all the time. So you need to be able to have something. And the only way to get that experience is by, a lot of internships are happening. I see a lot of them on LinkedIn. A lot of boot camps are happening. I see them a lot on LinkedIn. So apply to join all of those internships, uh, boot camps. sometimes I see individuals who are saying they are looking for people to join them on projects and all of that. Apply for those ones, even if it's not paying you, just get your hands dirty really, so that when you are asked, okay, you say, okay, I was part of this project, this is what we did, blah, 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 and all of that. Then you can also look to explore freelance contract roles or even volunteer roles in digital health startups, both locally wherever you live and globally. So I did a bit of this, in Nigeria. So a lot of the companies who were designing electronic medical record systems, I sort of, worked some of them for free actually to see what they were doing. And honestly, I picked a lot of skills from there. Then leverage your unique background. So, as healthcare professionals, we bring a very unique perspective to digital health. So, you should never underplay that. So, most of the roles I do today, most people are actually looking for that clinical background because it's usually very, very, very helpful. So, if you're a clinician or healthcare professional, you can highlight your experience or journey in this area. Then, if you're a tech professionals, you can also highlight your own, technical expertise and experience because everybody actually brings something to the table when it comes to, working and excelling in the digital health space. So these are some of the tips for you to excel. So in conclusion, it's very diverse and open to everybody from different backgrounds. I mean, looking at the work I do again, I'm constantly in touch with different people from different background, different occupation. So for you to keep yourself on top, you need to keep upskilling and keep learning really. And the future is full of opportunities for those who sort of embrace this digital health arena or industry. And I think that's it for me, really. Do I still have a lot of time? No, I don't have a lot of time anyway. So thank you very much. I'm happy to take any questions if you have.
Thank you so much, Dr. Ron, for that insightful presentation. I think we have some questions already. Hello, Prudence. You can unmute and ask your question.
Okay, thank you very much for the explanation and for everything. I would like to ask, please, what's the sections that was brought out? What role is perfectly suited for a mental health nurse?
A mental
Option
health
one or
nurse.
option two? Yes.
So in terms of
What are,
deciding,
yeah.
so in terms of deciding what area for you to consider as a mental health nurse, really. So again, there's no one size fits all, really. So again, there's what we call the SWOT analysis. So you have to look at your strengths yourself, your weaknesses, or where your interest lies. So, for example, for somebody like me, I'm more interested in the organizing and managing side of things, really just to coordinate everybody. That's where I excel. So typically, I'm now looking around project management roles, product management, just ability to see all those moving parts really. So if you're somebody who's looking to improve things really, so there are roles like quality improvement and all of that. So it's good to understand where you are actually interested then before you now start narrowing down to say, okay, this is actually what I want to do. Then a good thing is also to what I usually do, or I used to doing before was go up on LinkedIn, look at maybe mental health professionals who are now doing things in the digital health space, have conversations with them around what are you doing? What's your day-to-day activity looking like? Is it exciting? Do you enjoy it? Because I did that a lot before I now decided, okay, this is what I'm going to, sort of settle down for. So you need to look at this thing holistically before he now said, oh, okay, this is what I want to do now. I don't know if that makes sense.
Yes, thank you very much.
You're welcome.
All right, thank you so much. Let's take Rachel.
Hi, Doc.
Yes,
Am I audible?
very audible.
Okay, thank you for your presentation. I just wanted to ask if I'm a physician by training,
Mhm.
and I wanted to ask if you want to go into roles of clinical advisory and mentorship for digital apps and that sort of thing,
Yeah.
what are the certifications that are required?
So in terms of clinical advisory for, I think I get this question a lot. Clinical advisory for maybe startups who are building products or digital apps and all of that, right? So first of all, I would say I think you need to gain some understanding of how these applications work and how they are built in the background and all of that. And typically, I think this was the same trajectory I used. So most of these companies who are building these applications tell them, look, I'm a clinician. I'm going to help you improve your product. You don't need to pay me, and you join the team. So what this offers you is to a deeper understanding of what's like the life cycle or what's involved in building a product. So you're going to start seeing what they are building. And when you look at it from a physician lens, you're like, no, this is not what happens in the hospital, or a patient will never use this way and all of that. So that insight now becomes very handy. So by the time you do this for probably a year, 2 or 3 years, then across different products, really, then you are now in that position to sort of start advising people and start charging for it. So it really goes beyond having that certification in terms of, okay, maybe I'm a certified advisor or whatever. So it's more on your experience with these applications, really. Sometimes I even tell them, can you give me your application? Let me try it for free and see how it works. Does it make sense? I can give recommendations. So that is what usually happens. So because as an advisory role now, what typically happens is they reach out to you, say, "Hi, doc, we are building this new product. It's supposed to do one, two, three, four for the patient. Are you happy to give us some insight or advisory?" So because you already know the things you need to look out for, you've sort of developed a framework around the things you should be advising on, really, then it makes it easier rather than just picking up certifications and I don't know if that makes sense.
Yeah, it does. It does make sense. I think there's just a lot of information online which can be quite confusing,
Yeah,
which way to step into first.
yeah,
So thank you for that.
you're welcome.
Okay, thank you. So we'll take Kosi.
Oh, okay, thank you. Um, Good morning, Dr. Kelechi.
Morning.
Um, Good morning. I would like to first of all thank you for such a wonderful and insightful session. So my question, although I think you've answered part of it with the question that the lady asked. So, but my question is, so I understand that in order to grow, because I studied pharmacology and I've been in the project management career path for a while now.
Okay.
And I understand that yes, I believe that to move to digital healthcare, you have to have knowledge about, tech things so that when you are managing a team or software or IT developers, you'll be able to understand some of the terms they use, and so you're not lost. And although you've mentioned PMP and Prince 2 and the one for Scrum certifications, I believe those ones are kind of expensive. I don't know
Yeah.
if they are free, so yes, if there are other free sites, where you can just learn about all these things, those tech terms and like the Scrum. I know there should be free sites where you can just learn some things about tech and IT, so that in case you are able or you are leading or guiding a project
Yeah.
in software development for healthcare system, you will be, familiar with the terms that people are using, so you don't just feel lost. And I think that will even give you the confidence to be able to lead the project, and lead the team successfully.
Mhm.
Thank you. Thank you, Dr.
So I agree with you. So in terms of understanding the terms, really, so I mean, all these terms are everywhere, across social media, LinkedIn, Twitter, everything. So I think the easiest way really is once you pick up any term, just go on YouTube and check, or just ask Google or even Chat GPT, what does this term actually mean? Then it gives you a bit of clarity into that, because a lot of the project management certification courses and all of that, they don't really dive into the nitty gritty of what do these terms mean or whatever. So Prince 2 or PMP just gives you the framework on how to lead the teams. Okay, this is the plan. Where are we going? What's the work breakdown structure? Which report are we sending? It just gives you that framework. So, but understanding the terms and all of that is the homework you have to do, yourself. You see artificial intelligence, you go and check what's this AI people are even shouting about. Are there different types of AI? Then it makes sense, really. So the other part where it becomes interesting again, and I think you sort of pick that up when you sort of volunteer or do internships on projects itself. You now start seeing how the technical people work. You start seeing the language they use. So a lot of these things, until you experience them, even if you read for a million years, it might still sound Greek to you until you actually work with the people who are doing this or building a solution or whatever. So you're in the meetings, you're using all the terms. And initially, like when I started, I'm not afraid to say, please, can you pause? What does that term mean? So they just give me a brief overview. Then I go and do my homework later to understand what the details are really. So yes, if you have a good understanding of some of these terms, I think it actually makes you a better, project manager or product manager, really. Because like my work is easy because I understand the technical side, I understand the clinical side. So yeah.
Okay. Thank you so much, Dr. Ronald. So I think
Yeah.
we have another question in the chat session about Isaac, who wants to start a telemedicine startup. He has a background in IT and also has a training in health services management, but is asking for the key areas or skills he needs to master how to build a successful startup.
Mm, interesting. So for even though startup is not my forte really, but in terms of, first of all, where is the product? First of all, that's the first thing we're talking about. Where is the product? What's your unique selling point or value proposition? What's going to make yours different, from other people's telemedicine platforms? Wherever you are, what's the internet access? What's digital health literacy? Because again, telemedicine platforms, even though they are there, I think the adoption in this part of the world is still not where we think it should be. So you should always have that in mind. A lot of people who sort of started out building telemedicine have actually pivoted into other solutions. So most times you don't sell telemedicine as a standalone application or whatever. It has to be layered on top of something as an additional benefit. So if I was running a hospital and tomorrow I said, okay, I have a telemedicine platform for those who are not able to come, then it makes a lot of sense rather than saying, building this as a standalone for people to start using. So I think these are some of the things you probably want to consider. Then look up other telemedicine platforms, what they've done so far. I know some of them they've closed down because of one issue or the other, but you need to look at that. So again, it might not just be you building it alone. You can also look for opportunities for collaboration or a hospital that is already existing. You can say, okay, let's put this on top of your whatever, really. So just a few points to consider, really, before you now talk about funding, because building a startup is it's not beans anyway. So just some things for you to think about.
All right. I think maybe just to add to that, since you already to Isaac now, since you already have the IT background, which is something that is quite useful, and you also have some trainings in health services. I think what you might need to then add is the business knowledge. Um, Maybe take an MBA, a mini MBA, or go through some accelerators or incubation program where you can then learn business models, how to build a fundable business model, how to create pitch decks, how to pitch to investors. Even you have to learn a bit of product management because as a founder, you have to really know a bit of everything, right,
Yep.
to run a successful startup. So I think you would need then to focus on the business side of things since you already have some healthcare domain knowledge and you already have IT skills. That's already good enough. So then you have to look at the business side of things. So probably I would say maybe a mini MBA. Yeah. Okay, so that's all. I think the last question we'll take is Jacob and we'll round up.
Yes, please. I have to run very quickly.
Okay, all right. So Jacob, very quickly. Jacob, are you there? If not,
Yeah,
thank you so much. Are you there?
yeah, I'm there.
Okay, so very quickly, straight to the point. Thank you.
Thank you for this enlightening session. So my question is to Doc. What advice can you give a medical student who's planning to transition in the future into the digital health space? And from your experience, how did you narrow down to a specific specialty in digital health?
Good question, Jacob. So, as medical students, really, so I think best approach is to you already have the interest in digital health, right? And wherever you are, I don't know what medical school you're attending or whatever, you probably be constantly looking out for opportunities where you can learn. Then you also need to find a balance between, you know, doing your medical student curriculum and also balancing this side of things. So for myself, I really didn't get into this until I was done from medical school. So it was when I was doing my internship here. So I think the where I did my internship, they were just deploying these electronic systems. We're using this hybrid model, a little bit of paper, a little bit of electronic systems, and that was how I sort of got interested. And interestingly, the guy who was, I think, deploying it was actually a doctor who had moved to the other side. So I just got interested in that. I started asking the questions. So that's when I started getting a bit of the terminologies and all of that. So as I progressed in my career, in fact, every single hospital I worked with, they sort of also use electronic systems and applications or whatever and all of that. So I got deeply involved. So I tell a lot of clinicians or healthcare professionals, I mean, all of these are most of this digital health stuff, they're actually happening under your nose, really. So it's for you to bend down and pick interest to say, okay, I want to be involved in this. What does it involve? Can I be a super champion or super user? I remember in one of my roles, I was the one, training my colleagues how to use the system. And that came from a point of understanding in detail how the system worked. If there was an issue, I was the person they would call, Ronald, this thing is not working. What do we do? So before they even reach out to IT guys, they're already calling me because they knew I understood the system. So that sort of further deepened my understanding around these things. Then that's in addition to taking courses, volunteering for a lot of startups. So I work with a couple of startups for free to building different tools, offering clinical insights and inputs to say, no, this is what happens in a hospital. You can't do it this way. A patient doesn't just walk into the hospital and go and see the doctor. You haven't registered, nobody is taking your vital signs. That typically doesn't happen in an African setting, things like that. So by the time you add all of this up, then it makes a lot of sense. Then the last part is I actively sought out people who were in these spaces: project management, product management, quality assurance, quality improvement, business. I looked for a lot of them and I was asking them questions. Please, can you even break down what is it that you even do? They say you're a business analyst. What does that actually, mean? By the time people now start giving insights into what they do, what their day-to-day looks like, and all of that, then it starts becoming clearer to you. Okay, this sounds interesting. Then you're not at the same time looking at yourself. I did a little bit of coding for Python and SQL because I really wanted to understand what is it that these programmers people do behind the scenes. They keep shouting that it takes a lot of time, it's difficult to code. So I said I wanted to know. So I actually started a Python training program. I kept doing that, did that. I think the point where I now decided was it wasn't for me was I think I had spent about 6 hours writing one code like that. So by the time I hit the run button, the code wouldn't run. So I spent an additional maybe 2 hours trying to figure out where the problem was. I couldn't find it. I had to call a colleague, a developer, to look at the code. In less than 2 minutes, he found where the problem was. Like, can you remove that full stop over there? I removed it, clicked the run button, and it worked. I was like, okay, in as much as this is interesting, but I don't think this is for me. So I'm more around managing people, coordinating things to say, okay, this is how we should go. Have you done this? This is our next step, and all of that. And that's where I find my own fulfillment. So by the time you do this around, then it's easier to, you know, understand, okay, this is where I want to be really and settle down. So there is no harm in making those mistakes early before, you get to where we are now. I don't know if that's helpful.
Very helpful. Thank
All
you.
right. Yeah, thank you so much, everyone. I think we've really touched a lot onto this call. Thank you so much, Dr. Ronald, for your time. And
No
we're really
worries.
grateful for the insight shared. I believe you can also drop off now so you can
Thank you very
attend to
much.
Yes. Thank you so much, Dr. Ronald. We're really grateful for the
All right.
insight.
Cheers, everyone. Bye.
Thank you. Bye. So just to also add to what he had said before he left, sometimes the career trajectory is not really it's not linear, it's not straightforward. You have to make some turns here and there before you finally hit and figure out exactly where you fit in. I think my experience is also similar to Dr. Ronald's experience. I had to code, I had to do a lot of coding, programming, till I shifted into programs management and managing community, where I currently support the Africa CDC at the moment. So sometimes it's not just straightforward. You have to do different things, but what is important is that passion and interest that keeps pushing you to keep making those little steps till you're able to get to the exact niche where you then find your habitat or feel like, okay, this is what really works for me now, right? So next session, I don't want us to miss the next session really, because we've just started to this morning session is just to give us a general overview or a background um of what some digital health roles really look like and some skills you can gain to attain those roles. But in the afternoon session today, you have the opportunity to then meet these people one on one in your different breakout rooms where you can really engage them to explore specific career path. We have a breakout room on what's it called, on bioinformatics and genomics, where you will learn what pathway, how do I become a bioinformatician, how do I become someone who does genomics. So these are interesting career areas we believe healthcare professionals, students, young people um, can actually work on. We also have the health informatics pathway, where you also be learning the intersection between IT and healthcare. We also have a breakout room on AI in healthcare, where you'll be learning about, how we can use AI in healthcare, how you can become and maybe a machine learning engineer or an AI specialist within the healthcare setting. We also have a session to explore graduate school opportunities for, I think on the call today we've mentioned that sometimes you have to actually go through a graduate school program, maybe masters in digital health or masters in health informatics or even do a masters in health data science. So what does that opportunity or what does that program look like, and what are some scholarship opportunities available that can be maximized? So we have a breakout room for those who are at the stage where they want to really they want to improve their academic qualifications or gain more certifications. So we also have a breakout room on international organizations. How can I fit into international organizations like WHO, Global Fund, Gavi, Path? So we have an expert coming from Clinton Access Health Initiative, that's Chai, and is going to be walking us through how do you explore career opportunities within international agencies? How do you land roles within international agencies? What kind of skills, what kind of skills certifications will be needed for you to even be able to say you want to work with the likes of World Bank, WHO, and the likes? So we also have, so for Isaac who has asked about the startup pathway, we also have a session around those who are innovators. You want to build an healthcare product, you want to develop your own startup, you want to become an entrepreneur even as an healthcare professional. So we have that class or that breakout session around exploring digital health entrepreneurship pathway. Then lastly, we have the health data analytics pathway for those who are interested in data, who love analytical programming. You like to crunch data, you like to gain insight from data as an healthcare professional. So we believe the healthcare data analytics pathway is the right fit for you, where you can actually learn and understand the kind of skills you need to build, right, to be able to thrive in that career pathway. So please, once again, don't forget to join us by 2 p.m. West African time, where we actually, deep dive into each of these specific career paths. These are people who are already doing amazingly well. They are working with top organizations. So we believe they'll be able to give you great insight on how they were able to move in their journey and how you yourself could, join the train. So please, once again, don't forget to join us. Use the hashtag Digital Health Career Fair 2025 to invite your colleagues and friends. Registration is still open for today. Today is the main session, to be honest, for the webinar series. So please do not forget to join us by 2 p.m. West African time. We're going to be going to different breakout rooms to move around and really understand each of these career paths. Let me know if you have questions around the logistics for the event or any other questions you'd like to ask. If not, we'll see you 2 p.m. West African time today. Thank you. Do enjoy the rest of your day.